Alors, rebonjour à tout le monde ici dans la salle.
Welcome back to all of you who are here in person or online. So welcome back to this conference on health as an action lever against climate change. We talked about adaptation, mitigation, and actually it's been raining outside since morning, the beginning of the day. We've had a whole month of rain in one day. So apologies for our technical issues, extreme events that are affected us directly and affecting our internet connection. So right now we are going to start this session on how to encourage action on climate and health.
Guests are speaking in English. Remember that the questions you send through the platform and on your, there's a microphone, a roving microphone here in the room. Also hashtag, please tweet like a beast, hashtag SPFrance, IANPHI, IANPHI, and also for climate. You can put them all together in one hashtag or you can go separately. But please tweet, whatever you hear. Let's begin with Cristina Tirado, IPCC lead author. That's, of course, the Intergovernmental Panel on Climate Change. I see you, Cristina, and you are with the University of California. So was I. I went to Berkeley. I think you're with UCLA, right? Yeah.
Yes, with UCLA.
Yeah, I see you. I see you. Great. I see you. Great, Cristina. Good to see you again. How do we make this a win-win, win-win-win? And I know that you want to talk about the co-benefits to health, well-being, equity of climate action in different sectors. How do we make this a win-win for everybody so they see a payback if they do go for this connecting health with climate change, with fighting climate change?
Yeah, Chris, thank you for the question. Basically, what we tried to do when we were preparing the health chapter was to make sure that we were having a corner and a space to talk about co-benefits. So the way that we have been addressing this was, okay, we want a policymaker to have all the information to decide what could be the adaptation and mitigation strategy that will bring more co-benefits. So besides of having the benefits to the environment or even to health, we were looking for an assessment that was bringing co-benefits that could be on equity, on well-being, and many of the studies that were done since the last assessment report were also including economical benefits. So I will go very quickly through this. In the second report of impacts, adaptation, and vulnerability, basically what we have been seeing is that something very common is that we are just recommending move fast. There is time, but you have to be very fast this time because there is no more time to lose. So any delay in global action on adaptation will make that we lose totally this very brief window of opportunity that we have to adapt and to mitigate. So next slide, please. In the most recent report on mitigation, there was something different. The report was showing that the greenhouse gas emissions that are causing global warming are at the highest levels in human history. So if we go 2 slides in advance, let me see if this is moving. Okay, this one. So you could see that the emissions in 2019 were about 12% higher. That's how they were in 2010, and even 54% higher as they were in 1990. We are definitely not on track to limit warming to 1.5. So the way that these reports have been working has been focusing on climate resilient development pathways that are focusing on mitigation and adaptation with a goal of sustainability. If you see, for example, for health, what we had in the risks in Europe, you could see that in the diagrams of the Berlin Ember diagrams were presenting the key risks, and they were in principle major for key risk in Europe, under low and medium adaptation. And these key risks were focusing, or the first one that you can see was human mortality and heat stress, but it was also double and overlapping with the ecosystem disruptions due to heat extremes and an increase in average temperatures as well. So this key risk that is cutting across humans and ecosystems has very severe consequences, and this is driven through the increasing frequency, intensity, and duration of the heat extremes. And this is something that we have been dealing. And I will just give you an overview because this is super interesting, the way that the assessments have been done in this report. If you are familiar with the 1.5 report, what has the main assessment that has been done is always an assessment that is looking not only on the types of adaptation options. In this case, it will be adaptation for reducing heat impacts and risk to human health. But the important thing of these reports is that this time they are looking into the effectiveness and feasibility of these adaptation options. Of course, I mean, this is, I am showing here a summary of what could be in Europe. But the important thing is that we have been looking at the feasibility from the economic side, the technological side, institutional, sociocultural, ecological, and geophysical. So this is something that if you go through the different chapters, or for example, in the case of the health, you may find a lot of information from Europe in chapter 13, and you will find these excellent assessments that will give you an idea if they are sociocultural barriers or institutional barriers, like for example, in the implementation of the new blue and green spaces in existing urban settings. So the once that we have been looking into the adaptation options, we have been looking into what are the options available. Let me see if this is moving or not. Yes. I think there's now. If in every sector there are options available that we can have at least and use them to go by half the emissions by 2030, and to keep open the possibility of limiting warming to 1.5. Moreover, there is a potential to bring down the global emissions between 40 and 70% by 2050, but we will need the policies, infrastructure, and technologies that should be in place, right? So when preparing this for policymakers, the first thing that we were doing was to show them what they will get in terms of health if they achieve the Paris Treaty and the SDGs. So achieving them, we may get an annual reduction across of major economies. Among them, it was Germany. And we have been seeing and putting together several assessments and studies that are looking into the million of the reduction per year of millions of air pollution related deaths, or the millions of diet related deaths, or same thing due to the physical inactivity. So this has been the first package that was introducing the key messages for policymakers. Then we have gone through sectors, and basically we have been focusing and we have been working co-authors of working group 2, adaptation and mitigation together in this section of the chapter. So we were looking into the co-benefits of clean energy, and we were seeing that if we were looking into emission reductions that were fitting the Paris Agreement in relation to renewables, we could improve air quality and to prevent from 70,000 to 90 or almost 100 premature deaths annually by 2030. So there is a clear confidence statement that all these statements usually have been very high confidence or high confidence. And we have been preparing these assessments for different sectors. Then, for example, in the case of urban planning, we have been putting together most of the studies that we have on active mobility, on the co-benefits to health of walking and biking. It has been, they are from European cities. So they can bring physical and mental health co-benefits. And this is something that we have been concluding with high confidence, and the assessments are very solid. They have many studies backing up that. And they are bringing all these co-benefits, but also in the case, for example, of decreasing the need for an own vehicle, we have been also looking into the impacts of affordable public transportation versus shared clean vehicles, or all this access to active transportation that in a way is contributing to healthy, but also to equitable, more equitable societies that are having access to transport, and which is affordable. So same thing, I don't know if I have enough time, but same thing with the other sectors, and we can discuss them later. But in the case of urban greening and creation of blue spaces, which are contributing to adaptation and mitigation, and improving mental health and well-being, there has been several assessments on urban green infrastructure. Again, most of the studies were from Europe and funded from the European Commission.
Cristina, if you can hear me, yes. we do need to accelerate here because we got 4 voices in about 40 minutes. Yes. It's going to be very tight. So if you can please conclude.
This, that was it. Just to show you one graph, just to leave it there. The rest are sectors, and I have talked about them. But I wanted to show you just the introduction of the climate resilient development pathways, just to leave it there, and just to mention that these pathways are accelerating and gaining all the time that we don't have by adapting and mitigating at the same time. So I leave it there, and thanks a lot for the opportunity.
Thank you, Cristina. A lot of benefits we see. I had my roommate in Paris when I lived there was working for the IPCC, and she was constantly expressing frustration that they had all this information that not enough people were paying attention to. So it's great to see the IPCC at least making headlines now before it's too late. Thank you, Cristina. Let us move on to Dr. Francesca Racioppi, Head of Office, World Health Organization, WHO Regional Office for Europe, the European Center for Environment and health in Bonn. Francesca, welcome. It's great that the WHO is part of this conference, as it was with the Clean Air Forums that I moderated as well, talking with Dr. Tedros, the head of the WHO. And it's great to talk to you now about the human health angle of this. Please, let's hear from you.
Thank you very much. Good afternoon, and thanks, Cristina, for this comprehensive introduction to the topic. As an inception point here, just to get the discussion rolling, let me focus on two aspects, because I think that one of the main thrusts that we have here, it is how can we accelerate action on climate change, and specifically, how can we accelerate action also within the health sector. The first thing to say is how do we, when it goes to how to accelerate, it seems to be the time factor. I was thinking, as I was listening to Cristina, that in 1989, member states came together in Frankfurt for the first time, ministries of health and ministries of environment. They adopted the Charter Frankfurt on Environment and Health, 1989, and climate change was there. Yet no action, 30-something years later, we are still struggling to make this action. So what is changing and what must change is the sense of urgency. And this is why the IPCC report is such a stark reminder. What it means is, it means that we have to feel the topic part of our own agenda. So it is a topic that must be owned by, for example, in our case, the health sector, that we must feel the urgency of that. But the second thing is that we need the argument to prove that the investments that are required now will deliver benefits, not in 20, 30 years' time, by the time that we need for the climate to hopefully stabilize. But investment in the co-benefits deliver benefits now. So if we invest into clean energy, if we invest into clean air, if we invest into making our city more prone for physical activity, the benefit of that investment will be now, not in 30 years. And this is a very important game changer when it comes to persuading and bringing the arguments to the policymakers. The second thing that is helping us is that the evidence has become so much more robust than it was before and so much compelling. And this is why we are now able to demonstrate that, for example, investments into cycling and walking are not a fringe. It is not a part of, let's say, kind of environmentalism, cheap environmentalism, or Northern European kind of discourse. No. By investing into active mobility, not only we support more active life, and so we save lives, because every year in Europe, more than 1 million deaths are attributable now, these days, to lack of physical activity, but we are also significantly reducing emission of carbon. And this is something new that has emerged from the most recent research. So it is not just about electrifying the rolling stock, but it is about shifting to active mobility, because these shifts will deliver reduction in carbon. So I will close my initial introduction by saying that from the WHO side, we are very much committed to work with the member states into bringing together the evidence, developing the tools that they need. And I hope that in the rest of the conversation, I will be able to illustrate a few of these tools that we have developed to support this action, but to help people, the policymakers and the health sector, to open their eyes and see the opportunities that come from the co-benefits. Of course, adding this to our traditional work, which is about adaptation. And I have to say, I still remember the summer of 2003, July 2000 and August 2003, we were in touch with the colleagues in France. It was the big dramatic first heat wave that killed 70,000 people over a summer that year. And that was the time when we came together and we started the work, for example, on heat health action plans, on alarm systems, and getting together the international health community to seriously tackle into this. I will stop here for now, and I hope to be able to touch upon each and every one of these points a little bit later on. And Chris, I don't know if you want me to anticipate now that we are very proud as a WHO to have been together with the UK and Healthcare Without Arms at COP26, launching the COP26 health program. And I will not say a word about that because I want you to ask me about it, and I want to raise your curiosity about it. Over to you.
Grazie mille, Francesca. So, a più tardi, let me move to, yes, I want to ask you about that, by the way. I want to move to Aleksandra Kazmierczak, expert of climate change and human health at the European Environment Agency. Dzień dobry, Aleksandra. Can you give us from the European level how we can facilitate, how we can make it as an attractive thing to do to address health and fight climate change?
Good afternoon, ladies and gentlemen. It's a pleasure.
Bonjour messieurs, dames, mesdames, messieurs, c'est un plaisir d'être avec vous. Je travaille donc à l'agence de l'environnement, donc une agence de l'Union européenne.
And independent knowledge. So I would come from the standpoint that the knowledge about the climate risks to human health, but also the knowledge about the solutions that work, that are effective and cost efficient as well, is the absolute key to facilitate the action and to make this urgent call for action really come into fruition. So I just have a few very quick slides to introduce the European Climate and Health Observatory. It's an initiative by the European Commission and also co-managed by the European Environment Agency that was launched last year under the new EU adaptation strategy, based on the understanding that we are still not having sufficient knowledge about the climate change risks to human health, and that we need to pull together the knowledge and resources from various organizations working either on climate change, on health, on other aspects that are related, and work together to bring together this knowledge, develop new knowledge, and facilitate the knowledge sharing. So that's the European Climate and Health Observatory. It's a portal, but it's also a partnership of all those organizations here listed on the slide, also including WHO Europe. So just to give you a bit of a flavor what knowledge can be found in the European Observatory. We, for example, include the climate projections produced by the Copernicus Climate Change Services in hopefully an easy to understand manner, for example, relating to the projected climate health risks. We are working very closely with the top scientists in the Lancet Countdown in Europe initiative, who are assessing the trends not only in climate, but also, for example, in population vulnerability over the last decades, clearly showing that this vulnerability is growing, and that together with the increasing climate change impacts really creates the perfect storm in terms of the risks to human health. We also include some information about early warnings in relation to various factors, for example, the UV radiation from the Copernicus Atmosphere Monitoring Service. And finally, we also produce some knowledge. We recently published a brief evidence review focusing on the mental health impacts of climate change. But knowledge about the risks is only part of what we need to know. We also need to know about the solutions. So recently we've been looking into the national policies on climate change adaptation and national policies on health and how they cover the risks from climate change to human health and which sorts of policies are being put into place, which sort of actions are being planned. And we see that most of the actions that are currently planned are sort of preparatory in nature. They're about the monitoring of the risks, about awareness raising, about more research. So it really shows that we are at the beginning of the road. And of course, we need those actions. They are absolutely key, but we need to also focus on actions that are really tangible and practical. And to exemplify that, in the observatory, we include some case studies of implemented solutions, looking at various risks and various ways of addressing those. So for example, we look at the ways how we can control the vectors of different diseases, but also how to make the hospitals more resilient to the future extreme weather events, for example, through better stormwater management, at the same time ensuring the best possible access to nature for both the patients and the staff. We have a very interesting case study from Finland about 3 non-governmental organizations coming together to address the climate anxiety among young people and really ease their concerns about the future that they will have to face. And also some initiatives such as creating champions among nurses as one of the really trusted professions to bring in the message about climate change. So I would be very happy to talk about some of those details later. But what I really wanted to exemplify here is that when we look at the governance levels and we look at the European level, there's a very clear commitment to work across the different disciplines and across the different bodies on the impacts of climate change on human health and how to best address them. But we need to also share the knowledge that is being generated. So here's my plea to the other speakers and also to the audience. If you have a great initiative through which you address the climate change impacts on human health, please do get in touch. Let us know. We can work together to publish it and make sure that others can learn from you and can be inspired by what you're doing. Thank you very much.
Dziękuję bardzo. Dziękuję bardzo, Aleksandra. Do we have mic?
Thank you very much, Aleksandra.
Still there, right? Aleksandra? Yes. Yeah. I wanted to ask you because at this last Clean Air Forum in Madrid, there was your boss, Hans Brunix, and he launched the Air Quality Index app, which was so people can look on this app and see what their air quality is in their part of town. And supposedly that's linked to results. People can see the results of the policies of their cities in making their cities healthier, whether they're making healthier or not. How is that working? Can you give us an update on that?
I must say that I'm not directly working on air pollution. I'm working much more on the impacts of climate change on human health. But I must trust my director that if in this app it's really possible to see the effects of the local policies, then that is the case. We know for certain that the local actions aimed at the reduction of air pollution are indeed working, and activities in cities such as, for example, Malmö, just across the bridge from Copenhagen, are showing that that limiting the traffic, incentivizing walking and cycling really brings tangible effects in terms of reducing air pollution.
Yep, healthier city, healthier planet. Thank you very much, Aleksandra. Let me move to Tracey Cooper of Public Health Wales. Tracey, from a regional standpoint of Wales, what are your efforts in facilitating and in making this happen? How do you see the win-win-win from where you stand?
Oh, thank you, Chris, and good afternoon, everybody, and thank you for inviting me. I wanted, if it's possible, just to explore, Chris, your question through the lens of COVID and health equity and their relationship with climate change, given that they are public health events and they do overlap and should really influence how we take local targeted action. So we would consider COVID as a syndemic, and what a syndemic is, for those who don't know, is a simultaneous series of epidemics. So in the context of COVID, it's the impact of the infectious nature of COVID in its own right, the impact that COVID has had on the burden of disease, with many of our populations not being able to access healthcare services in a timely way, understandably, over the last couple of years. And thirdly, the impact of COVID on the broader socioeconomic population health harms. But COVID has also, as we've seen in all of our countries, exacerbated our underlying inequities and exposed new vulnerabilities for us across different population groups, particularly impacting health and well-being, social cohesion, and the economy. So we have a very great WHO collaborating centre in Public Health Wales. And in this context, in March of 2021, we published a report which was about placing health equity at the heart of COVID's sustainable response and recovery. And we used our colleagues in the WHO's framework, looking at health equity through a number of 5 essential conditions or wider determinants, which include health services, income security and social protection, social and human capital, employment and working conditions, and then finally, living conditions. So looking at Wales through this lens of health equity and how we address and recover from COVID, it showed that the populations with multiple vulnerabilities that have been compounded or exposed that we weren't as familiar with before COVID, and these being children and young people, minority ethnic groups, people living in or at risk of poverty and deprivation, people in insecure income and low work, and marginalised and socially excluded people. And we also, most importantly, back to your question, looked at, so what are the policies and the public health interventions that we need to look at to mitigate these inequities? And I think many of us who are joined today across different countries will know that one of the benefits through COVID is that we've all had to scale up our population surveillance. We've had to do rapid evidence analysis, and that has helpfully, but in a worrying way, polarized and exposed where we need to make targeted and universal measures to tackle the inequalities that exist. And that really is about placing health equity at the centre of decisions, of investment, and in policy changes in order for us to protect livelihoods, social cohesion and community resilience. So back to your question, Chris, in that context, in Wales and the UK, we are facing 3 big public health events: COVID, and I've just talked about the health equity of COVID, climate change, but also we are going through an EU transition, as colleagues will know, around Brexit. So in October of 2021, we do the health impact assessments across Wales. We looked at the impact of COVID, climate change and Brexit as a health impact assessment, and looking at how we bring these together to tackle these through better decision making and better policy change. And we looked at the cumulative and individual impacts of these 3, which clearly demonstrate that you can't take public health events separately. We've got to take them in a coherent and a synergistic and cumulative way. And just out of interest, and back to your original question, the findings of the health impact assessment that looked at those 3 areas identify common key determinants that are affected by COVID, for us Brexit, and climate change, being, we've heard these already with colleagues, mental well-being, food insecurity, health behaviours, environmental policy and regulations, employment and working conditions. Common population groups are also affected for all 3, particularly in rural communities, farmers, fishers, those on low income, children and young people again. And that climate change is a common theme for us in Brexit, but for everybody in COVID, and both of these provide opportunities to tackle climate change directly and indirectly for us. So we would say that the current time provides a window of opportunity for policy change for the co-benefits of health and well-being, economy and sustainable environment, and an opportunity to develop a really strong focus on green industrial revolution, green jobs and more employment to drive a fairer and more sustainable economy. So in closing, for us, placing health equity at the heart of policies and public health interventions to mitigate the impact of COVID can also be designed to tackle climate change, and in addition for us, Brexit. But it is all about health in all policies and all policies in health to transform population health and well-being. So I'll close at that and hand back to you, Chris.
Okay, Tracey, thank you. Thank you very much. I want to get to these questions, as many as we can, before we move to the next, to the conclusion. Here's one for you, Cristina. How do the IPCC teams see the lack of progress in the implementation of the member states' decisions? What have caught most of your attention regarding the challenges for the health sector? I guess that's two different questions, but what about this lack of progress? And, you know, after COP26, these countries every country has to come up with a plan. Cristina.
And at COP26, but we have been doing some analysis of the NDCs, and they were, like not addressing health.
NDCs are national. I forgot. NDCs are
the national determined commitments.
Okay.
That the countries are submitting to the UNFCCC. In relation to the Paris Treaty and the follow-up. So the first question that you were asking about the IPCC, how the colleagues they were seeing this, well, many of them, they see it with despair. I mean, you have seen all these scientists on strike. I mean, how many years they have to be producing reports saying that this is happening, that is super urgent, yep. And things are not moving. So there is a group that they have been reacting in a completely different way because they are not being listened. So I don't know if this is the question that the person is placing. And in relation to the probably Tracey could reply better in relation to the public health authorities, but I could say that the funding for low emissions technology from the UNFCCC is insufficient to address the needs for mitigation in low, medium income countries. So yeah, I mean, there are many opportunities for transfer of technology and innovation, but the actual funding for low emission technology is insufficient. So I don't know. I pass the question to Tracey.
Yeah, I guess you agree. There is a lack of implementation, and we hope to see that sped up, right? The actions matching the commitments. But Tracey, let's move to you on that, and as well, I'm seeing a question here. I'm translating it into English. Where can you find the resources for the solutions that are being put in place in different territories? How are you finding the financing in Wales? As we had, in the last panel, we kind of talked about that as well.
Yeah, thanks, Chris. I think accountability is really important in this conversation. Obviously, different countries their governments will focus in a different way. The commitment may be different. And of course, we would all say it needs to be absolutely first and foremost, really trying to achieve the requirements of COP26. But governments achieve it through organizations and through communities. So I think for me, it's how do governments hold, we are a predominantly public service country, how do they hold public services to account to deliver what needs to be done to make sure the right decisions are made? And I think Cristina mentioned this in her presentation. for a public health perspective, we present the evidence by looking at social return on investment through different interventions, through different sectors, so people can see the decisions they make, what's the return on investment then in tackling climate change. I think the question about resources is a really key one. It's difficult to try, and WHO have done a great job in coordinating and bringing resources together, which is very helpful for all countries. But it's people having the time to look at those. Finally, from a Welsh perspective, we're actually really fortunate. We have a piece of legislation called the Wellbeing of Future Generations Act. This is all about looking at making decisions today for investment for the future, including how we tackle climate change. So, and there is a cross-government framework and a commissioner that holds the government to account in implementing that.
That's true. That's true. What? Here's one for you, Francesca, over at the WHO. There are many UN interagency and agency committees, initiatives, calls, manifestos, etc. How much has it been impacted? How much has it impacted positively the transformation of the countries and cities with less resources to adapt? So that's a bit related to the previous. How has the scientific community? How can the scientific community help to make it more a participating and inclusive process? I guess those are two different questions. If you could answer briefly, Francesca, I know it's tough.
Yes, thank you. Yes, there are so many international initiatives.
Donc, il y a tellement d'initiatives internationales. Donc, je disais au début de mon intervention
that so far has been signed by 52 member states, 9 of which in Europe, and that now commits member states, and particularly the health sector, to two key actions: build the climate resilient health systems, and the second one is about developing sustainable low carbon health systems. So you can see that it is true there are very many platforms and so on, but little by little they are making a difference. We have to remember that the health for the first time has been featuring clearly in the COP26 agenda. So there has been a movement that has been successful from that point of view. There has been a massive mobilization of the health professions. So there have been millions of health professionals who have been mobilizing and signing petitions to draw attention on this area. And this is a sign that it takes a long time. I started at the beginning to say we started speaking about the climate change more than 30 years ago, but it is now taking place and making a difference. When it comes to the how can this become more participatory, I believe it depends on our ability to, again, making everybody feeling the ownership for this agenda. Tracey, you were speaking of the intergenerational approach that has been taken by Wales, and this is like a societal responsibility that we do have for that. So, but taking a responsibility and taking ownership of the agenda must translate into taking action now. So from our point of view as a WHO, we have been developing a number of tools, very practical tools that can be deployed in conditions and in places with relatively low technology or low access to advanced, for example, epidemiological knowledge or sophisticated modeling. If you think of a tool like RQ+, a software to measure the health impact of climate change, of air pollution, or the health economic assessment tool for walking and cycling. This is a tool that allows anyone, anywhere in the world, no matter if you have access to the most sophisticated universities, to estimate and calculate economically the health benefit of promoting physical activity and reducing the carbon through active mobility using basically two numbers, the number of people affected by the intervention that you're doing and for how much they are walking or cycling. So we are really trying to bring the evidence and to distill the evidence in a way that can be used and usable across the border by different people under different circumstances and by policymakers as much as activists.
Okay.
And I think that also the most recent evidence we're bringing together of the benefits of nature, green and blue spaces in relation to health and mental health will be additional tools that we can bring to the table and support action. But of course, it's a long way to go.
Francesca. Okay, thanks, Francesca. Let me move very quickly to a final question. I just got a couple of minutes left. This is directed for Tracey, but I'd like to also hear from Aleksandra very quickly, if you can both be brief. This says, translating from French, how have you been able to distinguish the respective impact of COVID, climate change, and Brexit on health, since the three are rather connected?
Yeah, absolutely. Well, and if the person who's asked the question, I have actually shared the two reports I referred to in the resources for the conference, so you'll be able to have a look at that.
Okay.
Unfortunately, I'd like to say it was a balance of some advantages and some disadvantages, but we've been doing weekly public engagement surveys since April of 2020, looking at physical activity, looking at people's impression around air quality, mental well-being, social isolation and health factors. And it has waxed and waned based on lockdowns, as you'd expect. And so building the tracking for that and quantifying the impact that that has on people's health is really the next phase for us. The health equity status report I talked about, Chris, brings all of those into one space through the lens of health, right, and so quantifies the impact that has. So please have a look at the resource and you'll be able to see it more clearly. I'll stop in this.
Exactly. So there's more, I guess there's more work to be done too on that. Aleksandra, a final word. How do you distinguish between the effect of all three in addressing all of them? But let's also, of course, focus on climate change and health.
Yes, I can talk about the impacts of Brexit in the EU, but one interesting way of looking at it is looking at the mortality among different groups, and there is a network collating weekly data on mortality. And of course, with the COVID, you can see the big peaks during the different waves in different countries when they happened. But for example, if you look at the summer months, and you can really see that the peaks of mortality associated with hot weather in different countries, in particular among the elderly. So I think that's how you can, is one of the ways of looking at this data to distinguish the impacts. And of course, when we talk about COVID, hopefully it's a relatively short-term impact on human health. If we talk about climate change, we look at a much longer perspective, both in terms of the trends and in terms of the future projections.
Aleksandra, dziękuję bardzo. Thank you also to Tracey and Francesca and to Cristina. A big hand of applause for all four speakers. Thank you very much. And I might remind everyone that those online, that you're watching online, there is a resource section there, resource portal, where you can get a lot of information on what was talked about today. In the next few days, you will also get a PowerPoint, the PowerPoints and the videos that will be posted there online. Bon, je vais passer en français.
So I'll switch to French again, and we'll go back to our word clouds. Let's have a look at the word clouds on screen. Which words, so what word do you remember after 2 days conference? One or two words?
quand tu veux.